Sometimes due to excessive force, like an injury, sport, road traffic accident, these ligaments can tear, so the kneecap goes out easily because one of them tears. More often than not, the kneecap goes out outwards because the inner ligament or the MPFL tears. In that circumstance, just reconstructing the ligament, that is making a new ligament, either by taking a spare part from your body called an autograft, or I use synthetic grafts also, which are great, nothing's taken from the body, great results. This is stabilized because it acts as a checker-in mechanism and prevents the kneecap from going outside and restores biomechanics. Sometimes the kneecap goes out because there is a congenital or alignment related problem, either with the whole lower limb. So suppose the patient is knock-kneed, that is their knees touch against each other. The forces act in such a way to pull the kneecap out. So correcting alignment is of primary importance. Some people, the alignment of the kneecap with the leg bone is not in a straight line. It's slightly towards the outside. That makes the forces act outwards, which make the kneecap go out more easily. We call it an altered TTTG ratio because this tibial tuberosity, which is a bony prominence in the front of your leg where the patellar tendon or the rope that connects the kneecap to the leg bone is attached, is a little outward. Sometimes the kneecap is excessively upwards, meaning if you notice this groove starts from about here, but above that there's no groove, it's flat. So imagine if the kneecap is very high, then it can easily go out because there's no concavity in the thigh bone or the trochlea. This is called Patella Alta or a very high riding patella. And in some cases the groove is not deep enough, it is flat, so the kneecap goes out easily. In these situations, what we do is, if it's Patella Alta, we bring the kneecap down. If it is an altered TTTG ratio, we medialize the kneecap, meaning bring the kneecap more towards the center. In these, how do you do it? You basically need to move the patellar tendon or the rope connecting the kneecap to the leg bone. However, if you just take out a tendon, healing may be a problem. So you take it out with a sliver of bone and reattach it in the right location, either down or more medial depending on what's wrong, and fix it with screws. You may also do a ligament reconstruction along with that, the MPFL reconstruction. And in rare cases, we may have to recreate the groove, which is called a trochleoplasty. I hope you understood.